My parents were always very independent. They always seemed to take care of each other. My dad met my mom when she was 13 and he was 15, so they got a lot of practice. It was really difficult when they were faced with health challenges and started to need some help. It was also really hard on me and my brothers. It seemed like every day we were getting calls. They needed to go to this appointment or that appointment, and it became pretty apparent that they really couldn't live on their own without some help, and more importantly, stay healthy. We're lucky to find the Elder Service Plan. Almost immediately after enrolling, we saw some real change for the positive. All their medical appointments were in the same location, including the prescriptions. If they did need to go to see a specialist, then transportation would take them, and that was a big relief for us. My mom attended the PACE Day Center each day where she could really socialize, and she loved that. When they needed services in the home, that was a big help too. And my dad, he'd still call me every day, but not because he had to, because he wanted to. He'd say, "Stevie, you won't believe it, they fixed my teeth. They got me some new shoes today." Just brought some amazing stability to the family. I'll see you a little later today, okay?
Okay.
My name's Lucas Akerley. I'm the Activities Coordinator for the Elder Service Plan in Winthrop. Today we're doing active parachute games. We have a ball toss with some music. It's fun. Keeping active at ESP is part of our plan to keep you happy, healthy, and independent.
Our mission at the Elder Service Plan is to keep our participants living safely in the community. And we do that in a number of ways, the first being with the physician and the entire team to take care of the person medically. We also try to think creatively and provide other things that they may need, be it shopping service, laundry service. We may provide respite for the caregiver, or even aid visits in our supported housing. We try to be as flexible as possible here in the Elder Service Plan to reach the goal of keeping our participants living safely in the community.
My name is Patty Ferrante, and I'm with the Elder Service Care Program, and I absolutely love it. Just talking about it right now makes me want to cry. Before I was in the SP, I was always calling my family and having them, pick me up to take me to doctor's appointments and stuff like that. And now now that I'm in ESP, I have the door-to-door service, coordinated care. My doctor always knows I'm coming. They always arrange my appointments. Everything is just so perfect. The program is fantastic. It really is.
Any pain when you do that? As a physical therapist in the Elder Service Plan, a big part of my job is to help people keep up with their strength and balance. A lot of times I see people after they get injured or some type of surgery, but another part of my job is to make sure people stay active with a regular exercise program so they don't lose the strength and balance they gain back.
What we do is we talk to the person to find out what they want. Do they want to increase their endurance, their strength? Do they want to be able to do things easier throughout the course of their day? We will work with them and develop a plan, and we move forward with it.
We try really hard to keep up with the mission of the program, which is to keep people in the community of their choosing for as long as possible and as safe as possible. Even sometimes just a cane or a walker can make all the difference in making sure people stay safe.
Very central to our plan and what we do here is the patient, the person. And the way we deliver that care is by having a care plan which centers around the person's goals, their choices.
As the medical director for the Elder Service Plan for the last 25 years, I've had the pleasure of watching our program grow enormously. While we started out largely in East Boston, we now serve participants in Chelsea, Revere, Everett, East Boston, and Winthrop. I think one of the real great reasons for our success is our ability to comprehensively coordinate our participants' needs. It's not just seeing the doctor or the nurse. Pharmacists, activities directors, nurses, nurse practitioners, van drivers, dietitians, all of us work together under one roof to keep our members healthy, active, and independent.